Well, the flu season has officially arrived. Although it seems like it's been here for weeks now, hospitals around the country and right here in Kentuckiana are overflowed. Are telling everybody to get the vaccine if you haven't yet. WHAS 11's Joe Arnold joins us now live from University Hospital. And Joe, a lot of people would think, oh, you needed to get the flu shot in October or September, so it's not too late to get the flu shot?
Healthcare professionals say absolutely not, because they don't know when the peak of this thing is going to happen. This could last for even months longer than right now, even though the flu has started earlier and started much stronger. About an hour wait, we're told, right now in the emergency department here at University Hospital behind me. But the local healthcare providers say they can handle this very big challenge. The flu is earlier, stronger, and filling doctors' offices, emergency rooms, and clinics across Kentuckiana.
Very aggressive flu virus this year, where patients are getting much sicker. We're admitting a lot more patients to the hospital for flu-related complications.
Despite reports in other U.S. metropolitan areas of hospital overcrowding and flu vaccine shortages, local healthcare providers say they are handling the increased demand fine. Kroger's little clinics in Louisville and Lexington have been inundated.
It is the biggest increase that we have seen. We didn't have the predominance of the flu and flu-like illnesses last year that we're having this year. And it's the earliest it's been in about 10 years, and it's more severe.
Some people have a scratchy throat, some people have a sore throat, some people have nausea, but everybody has the chills, the muscle aches, and the fever.
With health experts discouraging the spread of the flu, we decided to reach out to flu sufferers via WHAS 11's Facebook page. That's where Steve Lyons' family looked great at Christmas, but since then he and his 2 preschool sons are home with the flu. His wife and 2-month-old daughter sent packing to avoid it.
I was in the hospital on Sunday and ended up being dehydrated and had to have 2 layers of fluid to rehydrate, and then just kind of let the flu run its course from there. It is a very quick hit, and it is a very bad feeling for all involved for about a week.
The best way to cover a flu story is from a distance. You know, I was in Frankfurt yesterday talking to lawmakers, a lot of handshaking going on, and there was one new lawmaker who literally had a bottle of hand sanitizer in his pocket. After he shook people's hands, he would squirt it into your hand because his young children at home have the flu right now. Some hospitals, by the way, have these masks, like Baptist Hospital East, where if somebody comes into the hospital exhibiting open signs of the flu like coughing, they'll say, please wear this and protect people around you from catching the flu as well. Coming up at 6 o'clock tonight, more Facebook flu sufferers from WHAS11.com. Right now we're live at University Hospital. Joe Arnold, WHAS 11 News.
The national flu outbreak continues to surge tonight and right here in Kentuckiana, with no signs of letting up.
Some U.S. cities are reporting vaccine shortages and public health emergencies. So how are local hospitals and clinics holding up now? WHAS 11's Joe Arnold is live tonight from University Hospital. Joe?
We've been keeping you updated for the last couple of weeks now. Kentucky and Indiana have been reporting widespread flu, and now local health care providers say they are seeing an even bigger spike this week. They say they are keeping up.
Yes, we're swamped with people with the flu.
Yet, unlike some U.S. cities, Louisville hospitals and clinics report no shortage of flu vaccines and no state of emergency.
There is an hour wait to get into first care, but no, it's flowing fine.
Unfortunately, our wait times go up, and people have to wait longer in the emergency department, and it just overwhelms all of our resources.
Hospitals across Kentuckiana reporting a big instance of flu activity. At Floyd Memorial Hospital, a 90% increase they're reporting. At Norton, very busy. Here at Baptist Hospital East, about a 20% increase every day. If you come into the hospital exhibiting flu-like symptoms, they'll give you a mask to protect other patients too.
The severity of their body aches, the degree of their fever, the rapidity of the onset, I think it just leaves people kind of, I think people don't realize what a serious illness influenza is. You know, I tell people every day to get a flu shot, and they don't believe me.
In Hardinsburg, Kentucky, the Kaufman family missed their annual flu shots this year. Ashton Kaufman's mother says he woke up yesterday morning with a 103-degree fever. So what's it like on the front lines?
It's awful. We had no sleep the night before last. We were up every hour on the hour vomiting. We have tried to force feed liquids and tried to, well, no, there's been no food so far. He's just having Gatorade. No sleep.
Healthcare experts advise flu sufferers to stay away from others. Everyone, cough into your arm, wash your hands, and even if you've already had the flu, get the flu shot. Though the vaccine doesn't always prevent it, the shot can help keep the flu in check.
It's never too late to take a flu shot. We don't really know how long the flu season is going to last. It started early. It could last all the way through March. It's never too late to get a flu shot.
Now, we reach the Kaufmans, by the way, via the WHAS 11 Facebook page. You can let us know about your flu story through there. We also have been checking in with local major employers like UPS and the Jefferson County Public Schools. They are not reporting any major disruptions, as of yet at least, as a result of the flu. Yet, if your workplace is affected, I do want to hear from you. You can tweet me at WHAS 11 Joe. We're live at University Hospital. Joe Arnold, WHAS 11 News.